Do you know that feeling at the back of your throat that just won't go away, that need to clear it 10, 20 times a day, and at some point you can't even remember when it started? First it was just mornings, then it became all day, and now it's simply part of your life. You've tried lozenges, water, every remedy friends and family have suggested, and here you are, still dealing with the same feeling. Here's what I want you to understand right away. That mucus isn't random, and it's not simply age catching up with you. Every persistent symptom is your body's way of communicating something specific, and the question is whether we know how to listen. Today I'll walk you through 5 concrete, research-backed causes of persistent throat mucus after 55, and I'll also tell you which 2 of these tend to work together, making everything significantly worse. Let's start with the biology almost nobody explains, and that changes everything about how you understand this problem. Your body produces mucus every single day, non-stop, and that's completely normal and healthy. Mucus is your airway's protective coating. It traps bacteria, dust, and viruses before they can settle deeper into your lungs, and it keeps the delicate tissue lining your throat moist and resilient. Without mucus, your airways would dry out, crack, and become vulnerable to every pathogen you encounter. Mucus isn't the problem. The problem is what happens to that mucus as you age. There's a system in your body called mucociliary clearance. Your airways are lined with millions of microscopic hair-like structures called cilia. Their job, carried out millions of times a day without you ever noticing, is to sweep mucus upward and outward, keeping it thin and moving so it never builds up. In a younger adult, this system is fast and efficient. Mucus gets produced and cleared almost instantly. But with age, these cilia slow down, they beat less frequently, and the result is that mucus which would have been swept away in seconds at 40 can sit and accumulate for hours at 65 or 70. In practical terms, any factor pushing your body toward excess mucus production will hit harder and last longer in an older adult than in a younger one. This isn't a complaint about aging, it's simply physiology, and understanding it is the foundation for everything we're covering today. With that context in place, here are the 5 causes. Listen closely, because I'll also tell you which ones tend to stack on top of each other. The first cause is the one I want you to pay the most attention to, because research consistently shows it's the most frequently overlooked explanation for persistent throat mucus in this age group. It's called laryngopharyngeal reflux. You may have never heard that term, so let me explain it simply. Most people know classic heartburn, that burning feeling in the chest after a heavy meal. But there's a quieter, more deceptive version of the same problem. No burning in the chest, no obvious digestive discomfort at all, just a throat that won't settle down. Here's what happens. Where your esophagus meets your stomach, there's a muscular ring, a valve, whose only job is to stay closed after you eat, keeping stomach acid where it belongs. With age, this valve can gradually lose tone, like a rubber band stretched one too many times. And when it no longer closes completely, stomach acid travels upward, not just into the esophagus, but all the way to the throat, the voice box, and sometimes even the nasal passages. There's a precise physiological reason why this problem shows up mostly at night rather than during the day. While you're awake, gravity works in your favor. Even if some acid comes up, it tends to flow back down on its own, and saliva, which naturally neutralizes acid, is produced and swallowed constantly thanks to frequent swallowing. At night, 3 things happen together, and all of them work against you. The valve between your stomach and esophagus relaxes more easily during sleep, gravity stops helping because you're lying down, and saliva production drops significantly. It's the perfect combination for letting acid travel upward undisturbed for hours, right while your body is supposed to be resting. Here's an important biological detail. The tissue in your throat isn't built to handle acid the way your esophagus is. Even the smallest trace of acid reaching your throat triggers an immediate protective response, and your body quickly produces thick mucus to coat and protect that irritated tissue. It's completely logical biology. But when this happens night after night while you sleep, you wake up every morning to that familiar heaviness at the back of your throat with no idea why, because there's no heartburn, no chest pain, nothing pointing toward your stomach. The difference between classic reflux and this silent form is striking. In classic gastroesophageal reflux, heartburn shows up in over 80% of cases, but in this silent form that affects the throat, heartburn shows up in just 20%. In other words, roughly 4 out of 5 people with this type of reflux have no heartburn at all, just the constant need to clear their throat, a rougher voice in the morning, and mucus that builds up the moment they wake up. Ask yourself honestly, is your throat noticeably worse in the morning than later in the day? Does it get worse when you bend forward? Has your voice sounded different right after waking up? These are the fingerprints of silent reflux, and in the action plan I'll give you specific steps you can start using tonight. One more note worth your attention. If you regularly take anti-inflammatory medications for joint pain, like ibuprofen or naproxen, research has established that this class of drugs reduces your stomach's natural protective lining, making acid reflux, including the silent kind, more likely or more intense. If you take these medications regularly and your throat has been bothering you for a while, bring this specific connection up with your doctor. The second cause tends to arrive quietly, and that's exactly why it goes unnoticed. When people think of sinus problems, they picture the dramatic version: intense facial pressure, a throbbing forehead, a completely blocked nose. But in many adults over 55, chronic sinus inflammation shows up almost invisibly. Breathing feels mostly fine, no major headache, and yet the sinuses, mildly swollen and producing slightly more mucus than usual, are draining steadily and silently down the back of the throat all day long. This is called post-nasal drip, and a 2024 study confirmed that the average age of people presenting with it is exactly 55, which is no coincidence given your age group. Here's the frustrating part. Many people dealing with this take over-the-counter antihistamines for months, assuming it must be seasonal allergies. There's a reason that approach tends to disappoint. Antihistamines dry up mucus temporarily, but they do nothing for the underlying sinus inflammation causing the excess production, and dried, thickened mucus stuck at the back of your throat is often more uncomfortable than the original problem. The approach with the strongest research support is simple and affordable: regular nasal rinsing with a warm saline solution. A 2025 clinical review published in the journal Medicina, which surveyed evidence across a wide range of sinus conditions, concluded that nasal irrigation is an effective, safe, and low-cost strategy for treating and preventing upper respiratory tract diseases, and it's widely endorsed as an adjunctive treatment by ENT specialists internationally. High-volume saline rinses work by physically removing inflammatory mucus, reducing mucosal swelling, and improving the natural ciliary clearance function we talked about earlier, the very system that slows down with age. The single most important word here is consistency. 1 or 2 uses give you a day or two of mild relief. Daily practice done correctly produces meaningful, cumulative improvement. If you've made it this far, the next cause is probably one that affects more people than you'd think, because it involves something almost every adult over 60 has in their medicine cabinet: a blood pressure medication. The third cause is the one that surprises people most often, because it involves something almost nobody thinks to question: their own medications, taken faithfully for months or years. There's a category of blood pressure medications called ACE inhibitors, angiotensin-converting enzyme inhibitors. They're prescribed millions of times every year, they're effective, generally well tolerated, and they serve a genuinely important purpose. But they carry a well-documented class-wide side effect. They allow a substance called bradykinin to build up in the body, and in a meaningful proportion of people, studies report an incidence between 5% and 30% that buildup triggers persistent throat irritation and an ongoing urge to clear the throat. It's worth being clear about this. It's not an allergy, it's not something unusual happening in your body. It's simply how the drug works, and your throat happens to be sensitive to that effect. Here's the detail that causes this connection to be missed so often. The side effect can show up anywhere from a few days to several months after starting the medication. So if you started a blood pressure pill 8 months ago and your throat started bothering you 6 months ago, you may never have connected the two, but that timing gap is exactly the pattern research describes. If you take a blood pressure medication and aren't sure whether it belongs to this class, your pharmacist can tell you in under a minute. And if it does, there are alternative categories, ARBs, angiotensin receptor blockers, that control blood pressure just as well and don't carry this specific side effect. That conversation with the doctor who prescribed it is worth having. 2 causes left, and the next one is the one most people dismiss too quickly, thinking they already know it. It's worth hearing all the way through, because the detail that really changes things comes right now. The 4th cause surprises people not because it's complicated, but because it's something dismissed as too obvious to matter: hydration. But let me walk you through the physiology, because it's not what most people think. Your mucus is mostly water, and its consistency, thin and fluid or thick and sticky and hard to move, is directly tied to how well hydrated the surrounding tissue is. Think of maple syrup straight from the bottle versus syrup that's been sitting open overnight. Same substance, completely different behavior. Your mucus behaves exactly the same way based on your hydration level. Here's the specific aging-related twist that makes this more than just a simple reminder to drink more water. Research has clearly established that the thirst mechanism becomes significantly less reliable with age. A younger adult feels thirsty well before becoming meaningfully dehydrated. In older adults, that early warning system is blunted. You can be dehydrated enough to noticeably affect your mucus consistency and your day-to-day comfort without feeling particularly thirsty at all. Waiting for thirst to remind you to drink means you're consistently behind, and a mildly dehydrated state kept up day after day keeps your mucus persistently thick and sticky, amplifying everything else we've talked about today. A practical fluid target widely cited in clinical nutrition guidance is roughly 30 milliliters per kilogram of body weight per day, from all sources. Water, herbal teas, soups, and water-rich foods all count toward that. But the key behavioral point is deliberate, steady intake throughout the day, not catching up only when you feel thirsty. The fifth cause is one rarely discussed in videos like this one, and I think that's a meaningful gap, because for a significant share of older adults dealing with persistent throat mucus, the root of the problem isn't in the throat, the sinuses, or the stomach. It's in the gut. Here's what the research shows. Your digestive tract and your respiratory system share regulatory pathways through the immune system and the nervous system. The health of your gut microbiome, the trillions of bacteria living in your intestines, directly influences how reactive and inflamed your upper airways are. When the balance of your gut microbiome is disrupted, a state researchers call dysbiosis, it can trigger immune responses that promote excess mucus production in your airways. Not because anything is physically wrong with your throat, but because your gut is sending inflammatory signals your respiratory system responds to. This connection isn't metaphorical, it's anatomical and measurable. There's a long nerve, the vagus nerve, that runs from your brain to many internal organs, including your gut and your lungs, and it functions as a direct line of communication between the two. Through this pathway, signals generated in your gut can influence, in real time, how reactive and inflamed your airways are. On top of that, healthy gut bacteria produce substances called short-chain fatty acids, including butyrate, which travel through the bloodstream to your lungs and strengthen the mucosal barriers protecting both your gut and your airways. When your microbiome is balanced, this system works quietly in your favor. When it's disrupted, the same system can start working against you. This connection, sometimes called the gut-lung axis, is an active and growing area of clinical research. Multiple peer-reviewed studies, including research published in the American Journal of Respiratory and Critical Care Medicine and the Journal of Allergy and Clinical Immunology, have confirmed that gut microbiome disruption can trigger immune responses that promote airway inflammation. Animal studies have gone further. When mice received gut microbiome transplants from patients with chronic lung disease, those mice showed a measurable increase in airway mucus production, demonstrating a direct causal link between gut health and what happens in your airways. What disrupts the gut microbiome in older adults? A diet low in fiber and fermented foods, repeated rounds of antibiotics over the years, high sugar intake, chronic stress. These aren't exotic factors. They describe the daily reality of a very large share of older adults. You won't fix a gut airway issue with a throat lozenge, but you can start supporting your gut microbiome through consistent daily choices, and I'll include that in the action plan. Before I give you the full action plan, I need to take a moment that's genuinely important. Most of the time, persistent throat mucus in older adults is benign, exactly what we've discussed today. Manageable, addressable, not dangerous. But sometimes your body uses symptoms to flag something that needs professional attention, not self-management. Make an appointment with your doctor promptly if you notice any of the following: mucus consistently tinged with blood, even a small amount, difficulty swallowing that's gradually getting worse, unexplained weight loss alongside throat symptoms, a lump or persistent swelling in your neck, a significant voice change that isn't improving over time. These signs go beyond today's conversation. Don't work around them, bring them to your doctor. We've covered the 5 causes. Now comes the most useful part of this whole video: what to do about it, starting tonight. Stop eating at least 3 full hours before lying down. When you eat and recline right after, your stomach is still digesting, and the valve we discussed earlier has a harder time staying closed. 3 hours upright after your last meal is one of the most research-backed behavioral steps for reducing nighttime silent reflux. Slightly raise the head of your bed, not with extra pillows under your head, which just bends your neck, but with a solid wedge placed under the legs of the headboard or mattress. Even a few inches of incline puts gravity on your side and meaningfully reduces how much acid can travel toward your throat while you sleep. Before bed tonight, drink a full glass of warm water. This simple act supports overnight hydration and keeps your mucus thinner, so morning buildup is less severe. Tomorrow morning, before coffee and before breakfast, drink 1 or 2 glasses of plain warm water. This one habit costs nothing. It immediately starts rehydrating your body and loosening overnight mucus buildup before it takes over your whole morning. Get a nasal rinsing device from your pharmacy, a neti pot or squeeze bottle. Use water that's been boiled and cooled to a comfortable warm temperature, not straight tap water. Add a small pinch of plain salt and, if you'd like, a tiny pinch of baking soda, which may help thin mucus by gently neutralizing nasal acidity. Use it once a day, preferably in the morning. Give it 2 full weeks of consistent daily use before judging whether it's helping. Consistency is what separates the people who say it worked from the ones who say it didn't. Make an appointment specifically to review your medication list in relation to your throat symptoms. Bring a written timeline. When did your throat symptoms start? When did you last start or change a medication? If you take a blood pressure medication, ask directly whether it's an ACE inhibitor and whether an alternative in the ARB class might be right for you. To start supporting the gut-airway connection, add 1 small daily serving of a fermented food to your routine. Plain yogurt with live cultures, kefir, a small portion of kimchi or sauerkraut. These choices begin to diversify and support your gut microbiome in ways research links to reduced airway inflammation over time. This is a long-term strategy, not an overnight fix, but long-term strategies are the ones that actually shift your baseline. Set hydration reminders, keep water within reach in every room you spend time in, and eat more water-rich whole foods, cucumbers, watermelon, soups, herbal teas. Your mucus will thank you within days. A quick word on popular home remedies, because I know you've tried some of them. Honey genuinely soothes irritated throat tissue. It's not harmful and can ease symptoms temporarily, but it doesn't address any of the 5 causes we covered today. Dairy doesn't create mucus out of nothing. The science doesn't support that, but some people notice that dairy proteins make existing mucus feel thicker. If you notice a consistent pattern, a 2 to 3 week reduction trial is worth trying. Apple cider vinegar is a popular online suggestion, but for anyone with silent reflux, adding more acid into the system can actually make things worse. Caution is warranted there. Here's what I want you to take away from today. That persistent mucus coating the back of your throat has a reason, 5 possible reasons, actually, and most people living with this problem have never had a single one properly explained to them. Silent reflux, working quietly while you sleep with no heartburn to warn you. Post-nasal drip from low level, chronic sinus inflammation that never announces itself dramatically. Medication-related throat irritation, specifically from ACE inhibitors, developing anywhere from days to months after starting a medication and almost never connected. Chronic mild dehydration, running just below the threshold that triggers obvious thirst. And gut microbiome disruption, sending inflammatory signals your airways are responding to. None of these require you to simply accept a life of constant throat clearing. Each one has a practical, evidence-based response, and none of the first steps require a prescription or a specialist. They require some knowledge, some consistency, and a willingness to treat your symptoms as a signal worth responding to, not just a nuisance to manage. If someone has ever told you this is just getting older, I hope today gave you a different lens, because you're not just aging, you're dealing with specific, identifiable, addressable physiology, and you deserve to know that. If this video was helpful, leave a like. If you have constructive feedback for me, write it in the comments. Lastly, subscribe to the channel to stay updated, and see you in the next video.